Hi, great. Hello there, and thank you for joining BPIAChats today. I'm your host, Alexandria Maloney, and I hope everyone is staying safe and lifted during this time. So the purpose of BPIA Chat is to share the experiences and insights of members of the international affairs community and hopefully to inspire the next generation to explore opportunities in this field. Also, the thoughts and views of our guest speakers are their own and do not reflect the views of BPIA. We are currently streaming live, and this talk will be posted on our IGTV and our YouTube channel afterwards. And if you haven't already, please follow Black Professionals in International Affairs on Instagram, as well as our guest speaker whose handle can be found on the flyer on our page. And lastly, we encourage viewers to chime in below in the thread with any comments or questions that they may have. So without further ado, I will introduce our speaker for today. Renny completed his bachelor's degree in public health from Brooklyn College in 2018 and is currently a second-year master's student in the public health program at Cornell University. Before joining the Cornell MPH Program, Renny worked for the New York City Department of Health and Mental Hygiene, CDC, and SUNY Downstate Medical Center. His research focus is health equity and social justice. Renny wants to understand and address the multiple determinants of health, particularly among disadvantaged, vulnerable, and marginalized groups in both high-income, low-income, and middle-income settings. Thank you so much, Renny, for joining us today.
No problem. Thank you for having me. I couldn't pass this up to be here, so thank you.
Thank you. Thank you. So I'd like to start off by asking, how is the COVID-19 situation affecting your industry and the areas that you're involved in?
Wow, it's crazy. My industry is booming right now because of COVID-19, because it's a public health industry. So we are definitely on the ground, trying to figure out doing a lot of contact tracing and stuff like that, looking at clients, doing calls to clients, especially clients who are compromised in certain ways, who have diabetes, HIV stuff, and HIV. So you make those phone calls to make sure those clients are well, a lot of analytics. So it's a lot of hiring, especially within CDC. CDC is actually doing a lot of hiring. And Ground Zero, where New York City is actually doing a lot of hiring. The public health, the Department of Health is doing a lot of hiring in regards to like getting this under control and doing contact tracing to seek, just checking in on patients who are positive for coronavirus. So yeah, it's booming time to be in public health right now. Like it's a lot of remote work also, but there's a lot of underground work that people are being hired for right now, straight out of school, if MPH or not, the people are getting hired here.
Okay, thank you for that. So could you tell us more about what got you to where you are now, the academic, professional journey?
Wow. So I'm originally from Trinidad, in the Caribbean. I came here in '96, didn't work for a whole year. And then '97, I actually got a file clerk job on Wall Street. So I was on Wall Street for a very long time in regards to as an insurance adjuster. So I was doing insurance for a very long time, just bouncing from company to company. Then actually made it to manage a whole claims unit. That was pretty cool. The money was really well. It was a pretty good time. But at that time, I started school and I stopped. You know, I didn't know better. I came to this country, so my father didn't really know a lot. So I took that first financial aid check and went shopping. I didn't know what it was. I never went back to school or anything like that. So I literally didn't go to school. A lot of my mentors were always pressuring me to go back to school. When the market crashed, I lost my job. I got laid off. It was very hard for me to get a proper job. And then I had a son. My son was born in '08. And literally, I started back school because of him. I was like, I needed to get my degree. So I went back to school at Bronx Community College to get my international affairs degree. But I was doing really well in my health education class. And then it's crazy. While I'm sitting down in my kitchen feeding my son, a report came up on the TV and said 42% of America is going to be obese by 2030. And then to myself, I said, hey, I will have a job for the rest of my life. So with that, I went back to school the next day, and my professor was like really hyped that I wanted to do this because there are not a lot of us African Americans, Black
Mm-hmm.
folks, minorities, Hispanic folks in public health. So me wanting to
Right.
go into that field, like she gave me all the support that I needed. But then from at that start, I didn't really know how big public health was, and I started digging and realizing all these things. I started getting jobs here and there to just build up my background. Working on Wall Street, I realized that networking is so important. So that's how I really started. I was actually going to school, getting these internships, and also networking with people from like LinkedIn and stuff like that. So that's how I got into the field and just ended up graduating. I had to transfer. I actually became homeless in 2012
Mm-hmm.
and slept on the subway for a few days and all that stuff. And yeah, it was a pretty tough time. It was my birthday week too. So all that kind of
Mm-hmm.
I was actually in school at that time, so I stuck through it because I know this is the only thing I could finish that I had to finish. So end up doing that and stuck it through. Had to transfer from Bronx community to Brooklyn, back to Brooklyn to Kingsborough. I graduated from Kingsborough, went to Brooklyn College, and then ended up at Cornell, and that's why I'm here now. But true, along the way, I was trying to get all these jobs to build up my background to make me more competitive when I get my degree, or even if I got a job before I got any kind of degree. And I was actually getting these jobs without the degrees for the job. So
Mm-hmm.
that's how I ended up right now.
And Renny, thank you so much for sharing, more about your personal journey and stuff
Yeah,
too, because, folks, especially folks of color who are coming from a lot of different backgrounds and environments, have a story to tell.
yeah,
And
yeah,
sometimes we just see the success. We just
yeah.
see Renny at Cornell
Oh
or
my
the
God,
person
yeah.
in the position, but not all the sacrifice and the obstacles
Oh,
that
it's
had to
a
be
lot of
overcome to get
obstacles,
there.
and a lot of
Mm-hmm.
times we don't show the obstacles. But I tell people, because a lot of times you don't know what somebody's going through, especially. And I mean, for us, like I only had like a few public health professors that looked like me. Most of my professionals that I worked under were all white. So
Mm-hmm.
it's good when these kids are coming up, and especially when their parents are saying, "You don't want to be in public health. You should be." Every person I know wants their kids to be doctors or lawyers and stuff like that. So I
Right.
mean, a lot of people want people to be president, but they don't want their kids to be politicians. You know what I'm saying? So
Mm-hmm.
everybody got, their story and how they took certain paths.
Right. So I'm curious to know what are some of the, trends and biggest issues in public health. So of course, COVID-19 is like a spotlight situation right now. But what are some of the other trending areas that young people and students that may be interested in exploring this field that they could be doing more research on and looking in, in terms of what is trending and the priority areas in public health right now around the world.
A lot of times when I get these jobs, I look at how everything is structured within each place that I worked. There are not a
Mm-hmm.
lot of us, brown folks within these managerial management positions. So you don't expect us to be first priority. When I worked at a certain agency, um, there were people who were white Caucasian were making rules and regulations for people within black and brown communities, and they were not from there. When I worked at New York City Department of Health, anytime I asked somebody where they're from, they were not from New York City. They were from
Mm-hmm.
different states. So a lot of times they come here
Mm-hmm.
to go to a program, and then you need 90 days to establish residency. Within a 2-year program, you have
Mm-hmm.
residency, so now you're a New Yorker. And so now
Mm-hmm.
these jobs are all being snatched up by people who were not from New York City, people who didn't look like us. They would never. I had a time when somebody was telling me to go into these neighborhoods, but they weren't from these neighborhoods, and they were saying, "Yeah, you could go here, you could go here, you could go to the other," and they were from like on the West Coast, and I'm like,
Mm-hmm.
okay. So I kind of, when I recognized that, I kind of used that to my advantage to ask for more money, let them know, hey, these neighborhoods are this or whatever. So that's how trends. There are a lot of times we need to work in our own neighborhoods and we don't do it. And I think that's so
Right.
important, especially with something in COVID like this, because we know where my neighbor is sick. I know the agency needs help in this neighborhood, because there are a lot of different agencies in New York City that support these Black and brown neighborhoods. And so a lot of times we don't want to work in these neighborhoods, and I think that's like a big downfall for us. So I have always decided that I will more do community engagement within my neighborhoods, because that's how I will get strengthen my background and get to know the neighborhoods. So most of the deaths for COVID-19 are happening within Black and brown neighborhoods. And it's really, and especially men. Another thing about this field is one of the fields that are dominated by women. All my bosses were always women. There are not a lot of guys in my field. Not my mentors call me a unicorn, because I'm a guy, I'm a Black guy, I'm a guy that wants to go out into community and stuff. They're like, you're gonna get hired everywhere. So I always took that and ran with it. So I would be in like a lot of places that I've worked. I would be the only Black guy, the oldest guy, because I'm in my 40s. Everybody else, at that time I was at a public university, and everybody else were like in grad school at Harvard, NYU, and all these other colleges, and I was the only public school. So there are those things in your community that I think people need to really work with from their community that we don't take on and look at a lot.
Right. You mentioned the idea of kind of having working with folks who, in terms of cultural competency.
Oh, that's very important. Oh, God.
So could you speak a little more on how you believe, if your background and your culture and your experiences have worked as an advantage as a person of color in these particular environments, especially in the community engagement piece?
Well, I worked in a program called health homes, where with this program, they want people to stop using the ER as their doctor's office, because an ER bill is $1,200. A doctor's office bill is like, I'm just throwing numbers there, $120. Medicaid don't want to pay for that ER bill, so I would get these lesser names and go looking for these people. And sometimes it doesn't work out good for me when they see a 6'3" Black person stand up in front of their door, like, why are you here? And then I have to explain to myself. Then sometimes when they see somebody like me show up and explain why I'm here, I get walked into their house. I had a time a lady wanted to bake me a cake. I mean, a family wanted to take me on vacation. Like, you had these good times, but a lot of times it doesn't work for me. And I'm from Brooklyn, and Brooklyn very all these different cultures. So there's a huge Jewish population in Brooklyn, and those people end up on my list. And there's a time that I would go to these apartments and get the door closed in my face. But there are times that I would literally be able to have a chat with these people and let them know why I'm there. Is after a while, when they hear you and why are you here? I was looking for a lady for 3 months, and on the last day I found her on the last day of the third month. And this lady had not seen a doctor in 10 years, seen a GYN in 15 years, seen a dentist. And like, I called my supervisor, I'm like, I'm taking her to the doctor. And like, when you do stuff like that, that really is what, but cultural competency, a lot of people don't know it. A lot of people don't have it. It's something that you could be trained.
And what I mean in particular is, for example, you were talking about, you gave an example of how you all were identifying areas and how someone who was from that area, we can just do this, and this, and that'll work.
Yeah.
But because you have, and I ask this question because some young folks or students may think that, being a person of color is always going to be used against them. And that's why I want to try to challenge that with saying that we do bring things that may be advantageous and be a different perspective and be the expert on certain things in certain situations.
Especially in terms when you're talking about diversity and inclusion, we need people like us in the room to help make those decisions, because as we see in media and all these different departments, those decisions are being made by different people, and you see some of the outcomes are really outrageous. But even though the other person might be Black, but that person may be Black American, I'm Black I'm from the Caribbean. I'm Afro-Caribbean.
Mhm.
That's still a thing, a little gap there. So, but I
Mhm.
but I lived in these communities for so long, so I know the questions to ask, how to react, because in certain times it yes, of course, being black has its disadvantages and something that we work on every single day, but there are a lot
Right.
of advantages that I have seen, because all these populations that are being affected by all these outbreaks, from malaria to COVID-19, and then you have stuff in regards to HIV. Black MSM males are the highest risk for HIV. Um, and it's really
Mhm.
crazy out there. So this our people that's going through this. Yeah. And so when certain jobs pop up, I could look at a job and say, yeah, I'm getting hired for this job, because it just speaks to me and it speaks to what I've done before. So yes, there is a lot of advantages for being a person of color in your field. It's totally, especially in the policy making phase and doing all that stuff. Our voice has to be part of that, or else I don't think is worth it.
I agree. Thank you. I see we have some new folks who are joined. We're here with Renny John, who is a public health expert and
Yeah, I'm seeing
currently
most of them I know, so it's cool.
MPH student at Cornell and based out of the New York City area. So if you have any comments or questions, then please feel free to drop them in the chat below. So my next question is, what would you say has been the best professional decision that you've made for yourself this time?
Wow, the best professional decision. Wow.
You
I
can say going to Cornell.
Going to Cornell, I
I see you
think
as a Cornell
was
alumni.
one. Going to Cornell, I think I rank as number two. I rank Cornell as number two for that. One was I worked at Barney's. I had a really good job working for Barney's, New York. A lot of people didn't
Okay.
know that. I was about to get
Okay.
promoted to this really good position, making really good money. I didn't really have to do much. And I left that. I didn't take that, and I went to work for the New York City Department of Health for $9 an hour. And when you look at the
Wow.
numbers of $9 an hour, I have a son, it was kind of like, but that experience I got, and when I got there, I worked there for like a little over a year, but I worked with over 10 departments. And then that's how I was able to get my own program at CDC. So professionally, that helped me
Wow.
more than anything else. That's why I rank, Cornell should be ranked number one, yes, but overall, that was number two. That's number me. That's number two.
Yeah.
Like I really had to.
Can you tell us more about your project at CDC?
So with CDC it was a lot. I was working with this project. It was a travel health related. I was doing work with the travel health initiatives. So it's basically and the program was geared towards VFRs, visiting family and friends. So it's geared for like immigrants like myself who come to this country, live here for a certain amount of time, then go back. But when we go back, we think we from there that we're not gonna get malaria, we're not gonna get yellow fever, we're not
Mhm.
gonna we're not gonna wear our seatbelts because if they're not wearing it over there, so we're gonna drink the same water and eat the same street food and stuff. So a lot of
Mhm.
times we go back and we do all of this stuff and it has really bad occurrences. And
Okay.
also we will go to these countries and a lot of the target population for this group were West Africans. So now they would go home and not get these checkups, not get their shots and stuff, and now
Mhm.
would get stuff like malaria, then bring it back into the countries. So it's a way of like disease control, but doing it through in health education. So I would go to like churches and hair salons and stuff and do presentations. The biggest church congregation was in the Bronx to like 200 people. That was tough for me because it
Wow.
was 200 people, and then you had to answer like 100 questions or more after. But that's the stuff I like doing. So that's the work I did with CDC, and it was like I had taken over for somebody and I literally had to rebuild the whole client list. And I was on the ground in the
Wow.
Bronx, in New York City, going from place to place to place to all these different groups. Because you got to look at the numbers of the people who are getting infected and who are traveling. So I did that research and then try to reach out to those organizations like the churches and stuff within those communities.
Wow. So in terms of next steps for you, I'm just curious to know what's the next direction? Like, do you want to go back to New York City? Are you open to going to new regions? I see
I
you as
mean,
the head of the
it.
CDC one day. um,
um, yeah, I always tell my friends that just get into the government and just pull me in. But I need a break. I'll be honest with you. Maybe get a job and relax. Like, I love academia. I realized more. I was like moving into academic because every semester for the last few years, I've been actually going back to New York City and doing a public health class, careers class at the three different schools that I went to. So, and they were all, and these classes are made up of black and brown students like me. I didn't have that, so I try to do that every semester. And I've more finding myself. I even taught a population and health class, Dr. Carmen's class. Shout out to Julie giving me that opportunity. It was a huge opportunity because that class had 150 students, and
Wow.
I like dealing with the students. So I've been looking more to get in to academia. I actually had a really good interview with Columbia. I was on my third interview to see the Dean of Education to work for the program that denied me for grad school, but
Mm.
COVID-19 happened. So, you know what I'm
Um,
saying? So, I mean, I still have to send that email out, so I got to send them another email. I don't want to stalk them, but hey, it was a really good opportunity. But
okay.
I've been going to school every year since the fall of 2011. Really need a break from school. Like, literally need a break from school. Spend some more time with my son. That's really important, I
Right.
think. And I asked my mentor the other day, what do you think? Because I'm really looking at PhD programs and doctor of public health programs. Like I said, it's not a
Hmm.
lot of us that high up,
Right.
but she was like, school is not going anywhere. Spend some time with your son, and that's
Right.
it. Even though when I'm with him, all he want to do is play games and have me watch him play the games, but it's still
Um,
time. But yeah, I just want to get a good job. I mean, definitely New York City and chill there, and that's it. Yeah,
Thank you for sharing that. We're here with Renny John, who is a public health expert
not an
based out of
expert,
New
not
York
an expert.
City. Okay, based out of New York City.
Maybe, yeah. I'm an expert.
And
I'm a do that. Okay.
so I'll give folks an opportunity. If we get one question in the thread, then I'll incorporate that. If not, I'll ask two more questions, and then I'll let you give some concluding thoughts. But my next question is, if you could speak to your younger self, is there anything that you know now that you would have, that you wish you knew when you first started, or that you would tell yourself?
Don't drop any classes. I think that. Oh my God. Don't. I dropped a lot of classes. When I look at my transcripts and I have to explain these drops here and drops there, but a lot of times they were for stuff, like I said, stuff happens. And
Right.
sometimes you stress over it. And I've spoken to people at times that 2 weeks, like in the last month or 2 months of a semester or last few weeks, that they're thinking they can't get through it. And I never wanted to lean on the people around me. I never talked to professors. I never reached out to friends and families to really, cause it's tough. It's really, really tough. Like, I had my issues at Cornell, being at its first the tough being a black person at Cornell upstate in like -15-degree weather. Sometimes it just
Yeah.
gets you, and being from the Caribbean, it gets you. And I've had to really rely on people. Find your community and lean on those people, and those people are actually leaning on you at the same time. So my younger self, I would definitely not drop any classes and go to school earlier. I'm 40. I just turned 42. Like, I
Lies.
mean, yeah, I just turned 42, and I wish I had done this at a younger age, but my mentors say, hey, it wasn't your time. And it wasn't. I wanted to turn up when I came to this
Mhm.
country as a 19-year-old. I'm like, oh, I'm not going to school. I just want to turn up, have fun. I'm from the Caribbean. I want to
Yeah.
see America. Yeah, I
Yeah.
did that.
And that's the thing about the journey,
Yeah, yeah,
is
I
that
did
it's not
that.
over until
But
we say it's over.
yeah, but the thing is, what I realized, why I was much more mature and able to actually get stuff done and much more focused the older I got, and realizing what is needed to be done and stuff like that. So I
Mhm.
definitely would tell myself, yo, start school early and don't drop any classes. Just to be strictly honest with you, fully honest. I think that really, those drop classes really added like a year or two to my academic journey.
Mm. Thank you for sharing that. And then the last question that I have, and feel free to put any concluding thoughts onto this question, but it's just, what advice do you have for someone who's interested in a career in public health, a job in public health? What things should they be, looking into, in terms of education, professional opportunities, any resources or, organizations national
Wow.
organizations that they should be a part of?
There are a lot of organizations. So there are a lot of organizations on social media. I actually started my own organization on Facebook. I started a Facebook group called New York City Public Health Group, because just to post jobs and internships and stuff. But on GroupMe, there's a Young Public Health Black network that's everybody in there, like literally I call them superstars. Like in there, they're all superstars. And they're like there are all these groups. Few of the people I lean on the most, Latoya Bynum, like she's like the health education guru, Montrese Ransom, health law, and these are people like really booming in their field. Um, Public health field is a huge field. You don't actually have to be dealing with people one-on-one. A lot of times when you deal with public health, you think you're dealing with people one-on-one. Their data analysis, their health communications, they're a huge field. One of the books that I bought earlier on in my career was called 101 Careers in Public Health. And that has every career that you could think about and more that could help somebody figure out, oh, this is what I want to do. You like to draw, you could definitely do health communications. You want to deal with people, HIV. Because I worked in just talked about anything in public health. I worked HIV, diabetes, food systems. I ran a garden for my summer internship. I did a lot. Like I did a lot just to figure out what I wanted to do. But then what I realized, I still want to do everything, and all those fields come into one with health equity and social justice, because we see all the health disparities among our own population and among different populations. So I would definitely, if you go on LinkedIn, and I just started added everybody on LinkedIn that was Black. I had an MPH or a DRPH and no lion. And then I sent them a note, and they were really open to me about their education and their career goals and stuff. And there are a lot of, and didn't really know, there were a lot of us in this field that were actually doing a lot of great things. And I actually started reaching back to all my mentors. My mentors are Black and white, Hispanic, and they all have different views, but they all help me in a way that I couldn't ask for anything else from any of them. From Bronx Community College all the way up to Cornell, like I've met so many great people that touched my career. Reach out to the people that, especially within the schools, they have all these contacts because they went to school also, and they have all these contacts and they've worked in the field. So they're the ones that I use, because a lot of people say, oh, I don't want to go to school, but you go to school in a class of 30, you take 4 classes a semester, that's like 120 people you're meeting. So 120 people per semester, that's like basically your network right there. You could build your network off of meeting all these people. And those people have friends, have families that are in the same field. Most of the people that I've met in this field, I knew as friends before I realized they were doing public health. My best friend, I met on the streets of Mardi Gras. Not a place you want to meet somebody that's your best friend, but that's where I met my best friend. And she has a really great position at the top of CMS, Center for Medicaid and Medicare Services. And I never knew she was doing public health. I would be in Columbia University just hanging out, and I didn't know until after I started realizing what it needed to be done. But the people around you are your biggest resource, but a lot of times it's hard for people who are introverts to actually do that stuff. So I tell them to sit online or just reach out to me. I'll put them in. No, literally, I will plug anybody. I plugged somebody yesterday for a job at CDC, and I knew 2 other people that was within that position. So like I said, your network is, you got to know, your network is really good. You got to make it as well.
Well, Renny, thank you so much.
Somebody had a question.
I see that there's a question here. It says, because you mentioned it, do you have any insights on the future of food systems that will exist post-COVID-19?
Wow. So that's actually my capstone topic. So I would say wait for my capstone. But the food system is important. And the thing is, it's a lot of immigrants and minorities work in these fields, and those communities are being ravaged right now. And we all need food. So COVID-19 is actually putting a huge strain in our food system and in the entire world's food system. So that's something that needs to be addressed, I think, because if it's one, a supermarket is essential right now. And if no food can get to the supermarket, that's a problem. So yeah, there are a lot of different grants and stuff going out to um to these farmers and stuff like that. But the food system is very, very important. And we have a lot of minority farmers that actually get lost. All the small farms get lost within the big food system. And I think that that needs to be addressed. And they need as much help as the big industrial farms, because there are a lot of small farmers that are doing a lot of great work that they don't get to see the funding like a lot of the larger farms get. And I think the smaller farms need to meet that need, help meet that need to supply food for the food system.
Renny, thank you so much for sharing your insights and your expertise in this area with public health. How can people reach you if they want to, follow up?
So definitely, my Instagram is Big Red Ren, RENNN. But you can reach me at email address rlj83@cornell.edu. Or just reach out to you, and you could definitely get in contact with me, Alex. But definitely rlj83@cornell.edu or rjohn240@gmail.com. And I answer my emails because my phone is always in my hand. So definitely. So just reach out to me if you need any help with anything, and I'll definitely get back to you.
Renny, thank you so much, and thank you to everyone who joined in today. Please continue to check back on our pages for future and upcoming BPIA chats, and I'll see you all soon. Have a good